So I'm Dr. Pankaj Gupta from Access Health International.
Dr. Pankaj, welcome. What
Thank
is
you.
Access Health International?
So Access Health International is a not-for-profit think tank headquartered in the US. It works in 8 different countries, very close with governments. We do independent research and then work with the governments on policies.
Okay.
What I focus on is digital health. So we've been working with Government of India on the digital health policies, the standards, which came out very recently. The National Digital Health Blueprint was published.
Okay. Just one step back. Your think tank is funded by whom? Like, who are the contributors?
So it's a not-for-profit entity, basically international funding from funding sources like Bill Gates and Warren Buffett and things like
So
that.
NGOs, global
The
NGOs
global
that fund
NGOs
that.
they
Right.
fund it. Yeah.
Okay. So let's talk about this digital report and digital standards. What do you mean by digital health standards?
If you go back in time a little bit, all the different vertical programs like, the reproductive, child health, tuberculosis, vector-borne control program, each one of them created their own IT systems
Okay.
without really putting any standards in place.
When you say these are government programs,
These are government
to
programs.
help alleviate these.
Correct.
Okay, so
Correct.
they're government programs. They had their own IT systems.
Correct.
Okay.
And they didn't have any standards in place because they didn't think about it at that
Right.
point.
Right.
But now when you do triangulation across these programs, you
Right.
just can't do that.
Okay.
Because each one is built at a different point in time, in a different technology, and also having different standards or no standards.
Okay.
So I'll paint a picture that if there was a woman who had tuberculosis in the past and she delivers a low birth weight baby, you really can't trace it back. There's no
Okay.
way you can do that.
So she's now living in two different systems that
Right.
don't talk to each other.
Correct.
Okay, so tell me what your NGO has done in terms of setting these standards.
Sure. So what we did was actually been working on multiple different pieces of the standards. I was the one who was leading the metadata data standards for health long time back in 13-14. That got carried forward, and the EHR standards got carried forward into what has been put as the National Digital Health Blueprint. Now, this blueprint is an architecture. It's a reference architecture.
Okay.
It's based on the Digital India stack.
Okay.
Which has been already, implemented in various different government schemes like Jan Dhan, Aadhaar, mobile, and various other things. So we've just taken that and implemented it for health,
Okay.
and we put standards inside it. Now these standards are interoperability standards.
Okay.
We've taken global standards, modified it for India a little bit,
Okay.
and we played a vital role in bringing those knowledge pieces to the government, doing some independent research on those pieces.
So does that mean that the data inside these different IT systems now have a standard that they can talk to each other?
Yeah.
The IT systems themselves can't, but the data can
The data can
flow from one to the
Correct.
other.
That's
Okay.
absolutely right.
Okay.
So I won't say that they can, but now we've created a framework
Okay.
that is implementable.
Okay.
And once it is implementable, then the system will be able to talk to each other.
So how far away are we from these systems talking to each other?
That's a good question. So in India, for a very long time, we didn't have an incentive for adopting these standards.
Okay.
The work started long time back,
Right.
but we've had 3 rounds of pushing from the government saying adopt, 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 and the industry would say no, no, no.
Okay.
The reason was there was really no incentive.
Okay.
Now this time around we said, we'll do 2 things. One, we will figure out what the incentive can be, and fortunately with the Modi government coming in, Ayushman Bharat happened. And Ayushman Bharat's PMJ scheme becomes that incentive, the financial incentive for the industry to adopt standards. Because now we worked with NHA, National Health Authority, and we gave them something called e-objects. Now e-objects are machine readable objects that a claim can come in a standard format. Once a claim comes in a standard format, the insurance company can tell the providers that I'll pay you in a very short period of time. Earlier, the claims would get stuck from 20 days to 20 months. Now, the insurance company has a confidence of saying that I'll give you a turnaround time which is in a couple of days, maybe 1 day, 2 days, 3 days, whatever. So that becomes a huge incentive for the provider side
Right.
to invest into their own systems and say that, I will adopt the standards so that I can get these claims faster. So that's the one that we worked on the health insurance side. And then we are running an accelerator program where we got all these, product companies on board from the private sector, told them that, you have to build it into your systems and then enable the hospitals and the, doctors so that they can send these claims. So we sort of working on both sides.
Okay. Again, how far are we away from the claims being able to be settled in a couple of days?
Good point. So government is going to come out with a platform. So I'll give you an analogy of what happened in the fintech space. So government came out with the UPI,
Right.
and then government came out with the BHIM app,
Right.
and then government told the market that you can build your BHIM app equivalents,
Right.
and then the Paytms and Google Pays happen.
Right. Right.
Similarly, government also did in the GST. So they said, this is the GST
Yeah.
standards, and then 13 vendors were called and given the standard. They sort of worked on it, so you could go through any of these. We're trying to do similar.
Okay.
So what you're trying to do is we put the standard in place. We've defined the platform.
Right.
The platform is getting built by the government.
Okay.
And now the private sector is being invited.
Okay.
Come, the stage is set. You play on the stage, so to say.
Right. And you mentioned that this was in one of the chapters in the digital health blueprint that was released, last week or something,
It was
a few weeks ago.
Yeah, sure. So the digital health blueprint gives you an architecture
Right.
to sort of implement this.
Right.
But the Niti Aayog book, which is the health systems for New India, chapter 5 is digital health.
Right.
And that's where, I'm the co-author of that chapter.
Okay.
And we've written about the e-objects and how the financial lever will work.
And this book is available on the Niti Aayog website?
Yes, it is.
Okay. What was your experience here at the IBCA? I mean, how did this help, if at all, to what you were doing?
Sure, I met a lot of people.
And was that useful?
It definitely was.
So, did you find the government willing to listen? I mean, that's something that people kind of had this perception that the government or regulators don't listen. But from my experience, I saw every panel being at least having one regulator or government official on the panel, and they seem to be very open.
Sure.
Did you find that?
Sure. I mean, we anyway work closely with the government. So, I would not blame the people for that perception because for the past 70 years, that has been built over time.
Right.
But at least the current government, they're very open.
Okay.
And especially in healthcare, this time they've done their bit.
Okay.
They've definitely done their bit.
Okay. I just one more last question. Do you have any ideas from what your travels? Any ideas on how better healthcare access can be financed?
Healthcare kind of loses out to most investments because most of the investors, they would say that, I can get a better return from retail or from, BFSI or manufacturing. Why should I do health? And rightly so, I mean, they are generic investors. So what we need is specific funds which are more healthcare focused, having longer gestation periods, who have the wherewithal to be able to understand the intricacies of healthcare. And that's something which the ecosystem is missing right now.